The Ministry of Health has issued an alert to all counties across the country following a reported Ebola outbreak in the neighboring Uganda. According to the Health Cabinet Secretary Mutahi Kagwe, the move follows an alert forwarded by the Ugandan government to Kenya in line with East African Community Health protocols over the outbreak that was detected in Gambano village of Mududu sub-county in central Uganda. Following this alert, Kenya has organized a multi-approach of both international and local stakeholders, saying that they are ready to deal with the Ebola virus.
We are actually getting more ready to deal with monkeypox. And now here we are again preparing to fight Ebola. What we are here to affirm to the nation is that indeed the country, with all the lessons learned from COVID-19, we are equal to the task, and we shall handle this. And to assure Kenyans that as a directorate, as a ministry, the ministry is up to task and is making every effort to ensure that the country is protected. I'm sure they have been very, very concerned over surveillance efforts, and to reassure Kenyans again that surveillance efforts are in top gear, and everyone, if nothing is being left to chance.
The Kenya Health Professional Society reminding the current government that there is much more that needs to be done to realize quality, affordable and accessible health care to all Kenyans.
We should be able to employ more health staff so that they can be able to handle in case we are going to fall into that. But not even to handle when Ebola comes in. For you to be able to pick it early enough, you need a health worker who is motivated, who is not fatigued, so that they can be able to even suspect and be able to send these people for the laboratory tests. But if we are going to continue with the shortage that we are having, and the moment you are meeting that health worker, they are fatigued, they are having mental cloudness, they cannot even give you a proper diagnosis, then you are actually not going to be able to prevent it or to pick it at the earliest.
A 36-year-old lady who had traveled from Malaba town on the Kenyan-Ugandan border presented herself on 16th June 2019 to a health facility in Kericho after experiencing symptoms of headache, fever and vomiting. Plans are underway in Kenya to preventing Ebola after those reports.
As a country, we have always prepared for Ebola. I remember in 2019, before COVID-19 came, we actually developed a contingency plan for Ebola. We had very many false alerts. We responded, but it came to pass because that outbreak then was in the DRC. This time the outbreak is closer to us in Uganda, in central Uganda, in a district called Mubende. For example, in Uganda, they have one designated laboratory, and so far that is performing wonderfully. For us, we have 4. So it's not just a question of anybody testing for Ebola because of biosecurity and biosafety.
For easy dissemination of information, the Ministry of Health has obligated media the task of accurate information delivery.
We look forward to Government Kenya Ministry of Health really leading us and ensuring that we are able to, if we got a case, God forbid, tomorrow, we are able to optimally manage this case and really protect our country.
And if we learn from what's happening in Uganda, it's really important for us to strengthen community surveillance right now.
This comes as trainee medics receiving Ebola-exposed patients at Mubende Regional Hospital in Uganda have gone on strike due to lack of protective equipment. This comes days after the surge of the virus on Monday, September 19th. As confirmed by Uganda's Ministry of Health, the trainees, 34 in number, now demand they be moved somewhere safer, accusing the government of negligence and putting their lives at risk. A total of 36 people in Uganda have so far been suspected of being exposed to the virus, with 23 of who have succumbed according to official government data. For Ebru TV, I'm Ode Francis.